Have you ever wondered if a medication you take every day might be quietly harming your brain? Imagine this. The very drugs prescribed to millions for heartburn, insomnia, pain, or anxiety could, over time, chip away at memory, focus, and clarity. It sounds alarming, and it should. Even more surprising, many doctors themselves avoid these same drugs. Why? Because they know something most people don't. Some medicines may bring short-term relief, but carry serious long-term risks for the brain. Today, we'll uncover 5 widely used medications linked to Alzheimer's disease and dementia, how they affect your mind, and safer, smarter ways to protect your memory. Stay with me, because this could truly change how you manage your health. Before we begin, take 2 seconds. Hit subscribe and turn on the bell so you never miss practical, science-backed guidance for staying sharp, strong, and independent. 1. Proton pump inhibitors. Let's begin with one of the most common culprits, proton pump inhibitors, or PPIs. You'll recognize brands like omeprazole, Prilosec, and esomeprazole, Nexium, often prescribed for acid reflux, GERD, and heartburn. They block acid-producing enzymes in the stomach, effective short-term, but risky over time. Recent research shows that long-term PPI use can raise dementia risk by up to 44%. Why? Because these drugs interfere with the absorption of vitamin B12, essential for nerve and brain function. Chronic B12 deficiency damages neurons, leading to confusion, forgetfulness, and poor concentration. PPIs also disrupt the gut-brain connection, reducing good bacteria and increasing inflammation that can reach the brain and speed cognitive decline. Before automatically taking a PPI, ask yourself, is it truly necessary? Try smaller meals, avoid late-night snacks, cut caffeine, alcohol, and fried foods. If medication is required, use the lowest dose for the shortest time and review safer long-term options with your doctor. 2. Benzodiazepines, benzos. Next are benzodiazepines, used for anxiety, insomnia, or seizures. Names like Xanax, Valium, Ativan. They calm the nervous system by enhancing GABA, a neurotransmitter that slows brain activity. Short-term relief? Yes, but long-term use is linked to higher dementia risk. Here's why. Constant GABA stimulation suppresses natural brain balance, making your brain depend on the drug to stay calm. Over time, this slows memory formation, weakens focus, and can cause lasting cognitive decline. Many doctors now avoid long-term benzo prescriptions. If you rely on them, never stop suddenly. Withdrawal can be dangerous. Instead, ask your doctor about a gradual taper plan and explore natural aids, cognitive behavioral therapy, meditation, gentle exercise, or magnesium-rich foods. Remember, benzodiazepines offer quick calm, but the long-term cost may be your clarity. If protecting your brain is a priority, type SAFE in the comments. Let's see how many of us are choosing safety first. 3. Statins. Third are statins, like atorvastatin, Lipitor, and simvastatin, Zocor, vital for lowering cholesterol and preventing heart disease. They protect the heart, but cholesterol also feeds the brain. It's a key part of every neuron and helps produce hormones and neurotransmitters for memory and learning. Aggressive, long-term statin use may reduce CoQ10 and fat-soluble vitamins, nutrients needed for energy and nerve protection. This can cause fatigue, brain fog, or mild forgetfulness in some older adults. That doesn't mean you should quit statins. They save lives. But do review them regularly, especially after 60. Ask your doctor about CoQ10 supplements, a Mediterranean diet, and dose adjustments that safeguard both your heart and your mind. Some studies suggest that statins can cross the blood-brain barrier, interfering with cholesterol production inside the brain, potentially affecting memory and cognition. In fact, research shows that people taking statins long-term may face a higher risk of memory problems and cognitive decline. Now, not everyone on statins will experience these effects, but the association is strong enough to make careful review worthwhile, especially if you don't have major heart disease risk factors. So, what does this mean if you're on statins right now? Should you stop taking them? Not necessarily. For those at high risk of heart attack or stroke, statins' benefits still outweigh their risks. But if your risk is moderate or low, lifestyle changes, a heart-healthy diet, regular exercise, and weight management may protect cholesterol levels without compromising brain health. And if you've noticed changes in memory or mental clarity while using statins, bring it up with your doctor. A simple medication review can reveal whether adjusting the dose, switching types, or exploring non-drug options could be a better fit for you. 4. Non-steroidal anti-inflammatory drugs, NSAIDs. Next, let's look at painkillers most of us know well: ibuprofen, Advil, Motrin, and naproxen, Aleve. They're easy to reach for, but frequent use carries silent risk. Long-term NSAID use can raise the risk of high blood pressure, heart attack, and stroke. Here's why. These drugs reduce prostaglandins, chemicals that protect blood vessels and regulate circulation. With less protection, oxygen flow to the brain may drop, and over time, that can contribute to cognitive decline. NSAIDs can also damage the stomach lining, cause ulcers, and strain the kidneys, all of which indirectly stress the heart and brain. So what can you do instead? Try natural anti-inflammatories like turmeric or ginger, or add omega-3 fatty acids from fish or flaxseed to your meals. If you must use NSAIDs, do so sparingly and always under a healthcare provider's guidance. Occasional use is safe. Long-term dependence is where the danger begins. Quick check. Are you learning something new here? Type 1 if yes, or 0 if you'd like more videos on safe drug alternatives. Your feedback helps shape what I cover next. 5. Anticholinergic medications. Finally, we reach one of the most underestimated culprits: anticholinergics. These are used for allergies, depression, and bladder control issues. Examples include diphenhydramine, Benadryl, amitriptyline, and oxybutynin. They work by blocking acetylcholine, a neurotransmitter essential for muscle control, memory, and focus. But here's the problem. When you block acetylcholine over long periods, the brain can't communicate properly. Research shows that long-term use can raise dementia risk by up to 50%. People who rely on these drugs often experience confusion, blurred vision, and even hallucinations, symptoms that can mimic early Alzheimer's. It's no coincidence that many physicians avoid these drugs for themselves or loved ones, especially as they age. If you've used anticholinergics for years, don't panic, but do talk with your doctor about safer alternatives. There are newer antidepressants, non-drug bladder therapies, and lifestyle methods that achieve the same goals without harming the brain. Closing, stay proactive, stay sharp. Medications can save lives, but they can also come with hidden costs when used long-term without review. The key is awareness. Ask questions. Understand what you take and why. And always involve your healthcare provider before making changes, because protecting your brain starts with being informed. If this video helped you, type 1 in the comments to let me know you're following. Hit the like button so others can learn too. And before you go, subscribe and turn on notifications to join a growing community of adults over 60 staying strong, alert, and independent through science-based health choices. Until next time, stay curious, stay healthy, and always protect your mind.